Okay, it is a Korean language, so chunachmi yo. In our language, it's a bayani tambash. Okay, so I categorize my talk into four categories: my life, my place, my career, and why I am here. So what about my life? I born in 1978, and exactly 1 month after this picture, I fell down from the ground to the floor, and they took me to the doctor, and he gave me only 24 hours where I live or not. So actually, I am alive. So what about my family? This is my son, my wife, she's a dentist, and my two daughters, and this one really, she's an artist. Old picture of my family. These are my sister and brother, my mom, and the new picture of my family. And this is my father. He was a teacher, and right now he's retired. So what about my place? I am Kurd. I talk in Kurdish language. So this is a picture of map of Great Kurdistan, which houses about 30 million people, 30 to 35 million people. And this is our flag. But this picture doesn't like that right now because of the Cycles and Picot in 1960. They sliced the cake into two parts. So since that time, which is a French part and the English part. So since that time, we divided among these countries. So the large part with the Turkey, the second one with the Iran, and we are with the Iraq and Syria, and the small part with the Armenia. So what about my place? Our region is in the north of Iraq. This is our capital, and this is the capital of Baghdad. We are three major cities: Duhok, Erbil, and Suleimani. And these dashed lines, they are really belong to us, but there's a major conflict on it because of Kirkuk, because it's rich of oil. And what about Erbil? You can see the citadel of Erbil, which is about 6,000 years ago before the Christ, and right now it is in the list of World Heritage. And I showed you this small video on my city. It tells you a little bit our culture before. So this is my city, and there's a great mosque in my city. And this is a chain of mountain. So this is at late evening, and you can see in the daytime. At this spot, you can see the whole Suleimani, whole my city, and you can see the nice sunset. And this is our culture of how we have our clothes and our shoes, and how we celebrate. And we have a lot of delicious food. And I have proved with this video for you that our food is so delicious. It's an yes, it's an of course. So what about my career? I started residency in 2006 in this small hospital, which is an emergency, which is specified for burn hospital and trauma cases. And right now they built a cleft lip and palate for Brian Summerland, and right now he is in Suleimani. So we done every cases of cleft palate under the microscope because of his way. In 2009, I was accepted in the Iraqi Board of Medical Specialization, which is a 5 years program. And so I shifted to the Baghdad, to this hospital, which is specified only for orthopedic, maxillofacial, and plastic surgery. And we have seen only the microsurgery here. So another time, so we shifted also to the Baghdad Medical City, which is a major medical city in Iraq. And during that time, I went to Ganga Hospital for microsurgery course. I went to the United States to Ohio State University for an observership, and I finished my program in 2014. And this was my thesis, which is a bilobe mucosal flap for mucosal deformity. So what about my hobby? I go out with my friends for football, and I like to make some sketch, and especially about our job. What is in my mind, I do it on the paper. And I have more than 5 cameras and so many lenses, so I would take so many pictures, anything that I like. So this is our nature, outside nature. and picture of the sun and moon. I like the moon, and sometimes a funny picture. So this belongs to my daughter. She creates so many things like this, and I take advantage from her because she do something like that, and I use some of them in the paper and some of them in the presentation. So I like to have a very standard picture in operation in every patient, so in every stage. So pictures like this, I took it out from among 20, sometimes 20 pictures. So I have a bunch of pictures like that. You can use it for every presentation or in the paper. That's how I covered the my camera with the endoscopic sleeve. And for visualizing all pedicle, sometimes I sit down on the ground to have a good view. So what about my career in cosmetic surgery? I do so many cosmetic surgery, and especially blepharoplasty and rhinoplasty, deep plane facelift. I published this one in the aesthetic plastic surgery 2 months ago, which is a novel technique in lower blepharoplasty. So this one is a revision rhinoplasty and body contouring. What about reconstruction? I do with a mid-pore and cartilage graft, some cases of finger reimplantation, and perforator flap, dynamic facial reanimation, but not by free flap. Some cases of graft, nerve graft, and other cases of reconstruction. What is challenging is a free flap in my city, especially in the governmental hospital, because there is no any resource. That's why it is very challenging. So I am honored because I did the first ALT flap in my city, the first radial forearm, and the first free fibula flap, and some other flaps like ALD. So because it is challenging, after every finishing of the cases, we have a picture as a reward of ourselves. So this, if you look at it, it's at 2 a.m. at night. I have done some cases of nasal reconstruction, and this one, the last one, and I want to put it on the our lecture. So this is a total nasectomy by ENT surgeon. What I have done, we have done radial forearm free flap, just like it is mentioned by Minik. And after 2 years and so many procedures like expanded paramedian forehead flap for external lining, and after 5 to 6 procedure session, we have got this result. It is acceptable. So I shared my knowledge inside and outside of my city, of my country, and I have some paper, and this one is aesthetic plastic surgery. So why I am here? Why I am here? The first one is I promised one of my teacher, which was Dr. Jafar. He was in Baghdad. He is a microsurgeon. Really, he's a brilliant person, and he's one of the best I have as the best personality, and he's honest. So one day before my graduation, he told me how to do something for your city, and I promised him. I want to be on my promise, really. The second one is they newly opened the reconstruction unit in the oncological department in my city, and I want to share on part of this reconstruction unit. And the third one, I want to see you in person. What I saw before is only JP, and I know that behind JP there is a backbone. And JP brought me here, and we don't have met each other yet, but what I see, there's a lot of JP behind. So you are really great person, from the professor till the resident. You are all like a JP for me. What is my feedback? You have a very nice city and a nice country, really. You have good nature and an honored history, really, in the world. So I have tried this creature, and I never do it again because it sticks to the mouth. And what about my feeling? So ideally, I appreciate everything you have done. Any information from you, from the professor to the resident, and it makes me feel right I am at home. But I want to tell you one thing, that we are coming from the abroad, and we for learning, really. So sometimes our obstacle is the language. So when you are discussing the patient, not other discussion, when you are discussing the patient and about the procedure, I like this is my last day, but for the other resident, for the other that will come. So our obstacle is a language. So please make it a little bit in English, because we can ask a lot of questions because we know this is an operation, and we don't want to take the concentration of the surgeon from the surgery. And that's my point. And thank you so much, and I appreciate everything. Thank you.
So wish you the best, and if anything you want to learn or discuss, you can contact us anytime, okay?
Yes, thank you.
Wish you the best.
Thank you so much.
Actually, you stay a really short period.
Yes.
It's just the beginning of our relationship, and we
Thank
hope
you.
we can contact.
I will. Thank you.
Anytime.
Thank you so much. Thank you.
Wish you the
Appreciate
best.
everything.
Thank you so much for coming.
Thank you so much. Thank you.